I know everybody in Calderdale is going to be really disappointed that the government's bringing in new national restrictions, especially when people in Calderdale have been under restrictions for so long. I thought it'd be useful, and I should take the opportunity to tell you a little bit about the situation in Calderdale and why it's so important that we all do everything we can to stick to these national restrictions. So in Calderdale, rates of coronavirus have been increasing really quickly since September in all age groups and in all parts of the borough. What's of real concern is that rates are increasing faster in people aged 65 and over, and that's putting pressure on our local hospital services. We also know that sadly, during October, 12 people who live in Calderdale have died of COVID-19. They're people that are aged between 67 and 93, and they're 12 people that are a loss to their families and their communities. We estimate that 1 in 40 people in Calderdale have got the virus right now. And we also know that not everybody that has the virus has symptoms. And we also know that even those that do have symptoms, not all of them isolate and stay at home for the full period of time. That's why it's so important that these national restrictions are adhered to. And you can find out more about the specifics of the restrictions on the council's and the government's website. But actually it's really simple. There's 3 things that we all need to do. We need to limit contact with other people as much as possible, so that really we see as few other people as possible. If we do have to go inside where there are other people, to the shops and for food shopping, it's really, really important that we wear a mask. And finally, the third of the big 3 things is if we have symptoms, have a positive test or live with someone that does. We really must stick to the full self-isolation period and stay at home. I know another period of restrictions is going to be really, really hard for us all. Calderdale's a place of kind and resilient communities, and the best things that we can all do for ourselves, for those we love and for our communities is stick to those 3 big things. We know how to bring infection rates down in Calderdale. We've done it twice before and we can do it again.